Hey team, Melissa from Melissa vs. Fibromyalgia here, and we are talking about breathing. Why, how, what does it mean for us? Why should we care? All the good stuff. So it's not super sexy, it's really subtle, but everyone does it every day, and we need to do it better. So a lot of people actually breathe incorrectly, not breathing fully, chest breathing, mouth breathing, and more. Correct breathing is vital so that we can actually take the benefits that breathing offers. It's one of those little things that when we tweak can make a big difference. So what does breathing well do for us? It saves energy, yes please, improves energy, reduces pain and tension, again, yes please, helps us to activate the rest and digest mode or the parasympathetic nervous system. It improves digestion, lowers blood pressure, reduces our heart rate, decreases stress, and improves cognitive function. All of those things are things that we want, right? So, another thing it can help with respiratory issues, back and chest pain. Now, I started researching this because a member of the members only group was telling me that she was having trouble in this area. And this is one of the things that came up. So, here's a quote. One of the benefits of breathing deeply is that it helps to release tension in the diaphragm and primary breathing muscles, relieving many long-term respiratory issues such as asthma and breathlessness. It opens up the chest, releasing tension from the intercostal muscles and around the scapula, erector spinae, and trapezius muscles, allowing for a more relaxed posture. A lot of tension in our chest can be from bad breathing. It also helps us to activate the parasympathetic nervous system, which helps us to calm down. Now, if you've followed me for any amount of time, you'll have heard me talk about this for a while. This is why I'm so obsessed with yoga and meditation and deep breathing. So just a few deep breaths can help us to relax and calm down, even if we've been anxious, scared, or in pain. It is the quickest tool that we have in our arsenal to respond to stress. Please note, I'm not saying it can cure anxiety or depression. It's not some magical fix, but I'm saying it can help as an adjunct treatment. It improves the cardiovascular system. So deep diaphragmatic breathing tones and massages and increases circulation in the heart, liver, brain, and reproductive organs. Sounds pretty important, right? In one study of heart attack patients, 100% of the patients were chest breathers, whose breathing involved very little diaphragm or belly expansion. 100%. Another study found that patients who survived a heart attack and who adopted an exercise regime and breathing training afterwards experienced a 50% reduction in their risk factor of another heart attack in the following 5 years. Okay, so breathing is good for our heart. Breathing well will reduce our risk of heart attack. So if you have had a heart attack, please take advantage of all of the breathing tools that I'm compiling in the members library because they will help. We want to get that breath into the diaphragm. We want that diaphragm doing its job. So what does this actually mean for fibromyalgia? All the benefits that breathing well offers us are really essential for us, right? For all of our symptoms. We need to save energy. We need more energy. We need to reduce pain and tension and activate the rest and digest mode and all of the benefits that I mentioned earlier. It's also actually really easy to learn and practice. So below we'll talk about what breathing well is and my easiest recommendation for breathing. I have a couple of breathing practices for you on YouTube. And I have a whole heap of breathing support in all of my yoga programs. So it's a basic foundational thing that we go through in every program. Foundations of yoga for fibromyalgia, restorative yoga for the chronic life, and yoga for the chronic life virtual membership studio. It is that important. There is a breathing 101 module everywhere. Breath is central to yoga. So what is actually breathing well? It's using your nose, not your mouth, filling your abdomen and not your chest, and taking the time to focus on it each day. So what is my easiest recommendation? Inhale for a count of 4, pause for 2, exhale for 6. So you adapt the numbers to what work for you, but you're focusing on making the exhale slightly longer than the inhale. For example, inhale for 3, pause for 2, out for 4. So how can you practice? Like I said, yoga and meditation are really great. Foundations of yoga for fibromyalgia and restorative yoga will be coming again soon. And we have modules dedicated to breathing. You can also commit to practicing deep breathing every day for several minutes. I've got a few available in YouTube that you can practice. If you're a member, there are a few in the members library you can download and practice anywhere, anytime. I also have a meditation toolkit. So there's a lot of resources out there, and I'll provide some links below. Let me know, how do you breathe? Let me know if you practice it. Let me know how it goes.